This tutorial covers how to submit data for Outpatient Recognition Program Target Type 2 Diabetes. Log into the data platform at aha.infosarioregistry.com/login using the username and password sent to you via email after registering. Pause here to review further details on screen now regarding how to register your organization and get a user account. You will submit Target Type 2 diabetes data through program forms. Click either the icon under Get Started or the link in the left navigation panel. If your organization has submitted in the past for any outpatient recognition program, you may have existing forms under the Edit Form section, like I do here. Each date represents the calendar year from which that data was collected. For 2023 recognition, you'll need to submit a 2022 form. If you or another member of your organization have started a 2022 program form for Target Type 2 diabetes, you'll see that here. If so, click to start adding data. You can see that I have a 2022 form for two other programs, Target BP and Check Change Control Cholesterol, already. I don't have a 2022 form yet for Target Type 2 diabetes, so I'm going to click Add New next to that program. I'm submitting for 2023 recognition, which is based on 2022 data. So I'll type 2022 into the reporting year field and hit Submit to start. Target Type 2 diabetes has 3 tabs of data to enter, found under Tabs on the right. The first tab, Participant Information, contains questions about your healthcare organization, including your total adult patient population in question 3, a breakdown of your patients by race and ethnicity, and a breakdown of your patients by payer group. The gray boxes on questions 5 and 6 cannot be edited. They auto-populate to total the number of patients entered above. That's because the patient breakdown by race and ethnicity, as well as the patient breakdown by payer, must equal your total patient population given in question 3. The second tab, Clinical Practices, is new. Questions 7 through 12 are meant to serve as an assessment of your organization's practices for diabetes care, particularly assessing and managing risk for cardiovascular disease, use of guideline-based medical therapies, and preventing chronic kidney disease. If you are unable to answer a particular question, please check with clinical staff familiar with these areas. Selecting the first option in question 10 will prompt an additional follow-up question that must be answered. You must answer yes on question 12 to be eligible for recognition. Tab 3, Measure Submission, includes the measured denominator and numerator questions that will determine your measure performance in subsequent award status. There are 3 opportunities to enter measure data. The program's main measure, diabetes hemoglobin A1C for control, is required for award eligibility. The other 2 measures are cardiovascular disease-focused measures. You only need to submit data for one. Note that this program's main measure, diabetes hemoglobin A1C for control, is an inverse measure, which means it's measuring a negative patient outcome. A lower percentage indicates better outcomes. The other 2 measures, MIPS 438 statin therapy for the prevention and treatment of cardiovascular disease and MIPS 236 controlling high blood pressure, are standard measures where a higher percentage is indicative of better outcomes. For award eligibility, in addition to answering all questions on the participant information and clinical practices tabs, you must enter data for the diabetes measure and one or both of the cardiovascular disease measures. Choose whichever is easiest or demonstrates the best performance. Note that these measures are identical to those included in our other outpatient programs, Target BP and Check Change Control Cholesterol, so you may already have this data easily available. However, while these measures are included in other programs, the data is not shared between programs. It must be re-entered into the Target Type 2 diabetes form. Once all fields are complete and no errors are detected, return to the Participant Information tab where the Data Entry Complete checkbox becomes available. Check this box to mark that you are finished entering data, and then save. You can save or save and exit and come back at any time to revise your data. A snapshot of all data in the platform, complete or incomplete, is taken at the date and time of the recognition deadline to determine award status, but you can revise your data at any point up until the snapshot time. Let's start entering our data. Before you begin, make sure the data you submit is representative of the healthcare organization you're currently viewing. Look left under Currently Viewing or at the top right to orient yourself. I recommend having the data collection worksheet available or filling it out beforehand for ease. You can find this worksheet by navigating to the library. I'm right-clicking to open in a new tab. In the library, click on Target Type 2 Diabetes Data Collection Worksheet to download the PDF. Questions may change from year to year, so please ensure that you have the latest data collection worksheet, which you can find on the top of the first page. The worksheet contains additional guidance on how to answer each question, especially for question 6, which asks for the patient breakdown by their primary payer. Scroll to page 7 to see additional detailed guidance. You can also use the official measure specifications for each measure, which you can find by navigating back to the program form, clicking the Measure Submission tab, and then clicking the link for MIPS 1, MIPS 438, or MIPS 236. Here are what those measure specifications look like. I've navigated back to the Participant Information tab to get started. The first question asks if your organization diagnoses and manages patients with diabetes, up to and including prescribing medications. A yes response is required to be eligible for a 2023 award. The second question requires you to certify that the attestations entered in the form are accurate to the best of your knowledge. A yes response is also required here to be eligible for a 2023 award. Question 3 asks for the total adult patient population, ages 18 and above, who had an office visit in 2022 for your organization. When pulling data for this question, make sure you are saving this query and can further break down that same patient population by race and ethnicity and by payer group. My demo organization has 37,155 patients ages 18 and above. For question 4, input how many providers your healthcare organization has. If you toggle back to the data collection worksheet, we are looking for all physicians, nurse practitioners, and physician assistants in your outpatient organization. My demo organization has 94 providers. In question 5, we ask for a breakdown of how your total adult patient population, ages 18 years and older, self-identify by race and ethnicity. This question is based on Table 3B of the HRSA Uniform Data System reporting requirements for 2022 Health Center data. The same question appears in our Target BP and Check Change Control cholesterol program forms, so you may already have this information available. All fields must contain a value. Please enter a 0 where there are no patients. Here's the data that I have. The final 3 fields are inclusive of all patients who have either their race, ethnicity, or both unknown or undisclosed. If they have identified as Hispanic or Latinx, but not disclosed their race, place them in the first of these 3 final fields. If they have identified their race, but not their ethnicity, place them here. And finally, if you know neither their race nor ethnicity, place them in the final field. Once all the fields are filled in, an automatic total of what you have entered populates in the gray box at the bottom. This box must equal your answer to question 3. For question 6, take your total adult patient population given in question 3 and break it down by the patient's primary payer. Not sure which group is considered your patient's primary payer? Use the guidance on the last page of the data collection worksheet for questions. Here's the data that I have for providers and payers. If you're still not sure on some patients' payer groups, put them into the other unknown category. Once all the fields are filled in, an automatic total of what you have entered populates in the gray box at the bottom. This box must equal your answer to question 3. If it does not say I changed my other public patients from 1,326 to a 0, an error will appear at question 3. Because it's a red error, I won't be able to save. For row errors like this one, I can delete one of the fields that's contributing to my subtotal to make the error disappear. This allows me to save and come back later once I have identified the error in my data. However, all fields must be filled in to be eligible for recognition. So in order to fully fix this, I must eventually either revise question 3 or my payer group totals so they match up. Next up is the Clinical Practices tab, which we can find by clicking the tabs icon on the right. This is a new section. The parent program of Target Type 2 Diabetes, Know Diabetes by Heart, is entering a new phase and expanding its focus to include equity in care, accelerating team-based care models, and empowering individuals to be active participants in their care. Knowing and implementing the latest clinical guidelines is critical to supporting each of these goals. To better support organizations in their awareness of and use of the guidelines, we want to learn about your current practices. We have added a series of questions about guideline-directed pharmacologic therapy and kidney health screening to understand how your organization incorporates these into existing workflows. The answers to questions 7 through 11 will help inform the creation of additional resources and trainings, as well as the direction of future recognition criteria. Note, as you enter your answers to these questions, please consider the organizational area your data submission represents. For example, if the facility name in the data platform is ABC Health System North Clinic, and the other data submitted are specific to this facility, please answer the below questions with only North Clinic in mind. However, if you are submitting data on behalf of the entirety of ABC Health System, please answer the below questions with the whole of ABC Health System in mind, to the best of your ability. Question 7 is a modified version of a question asked in previous years. We want to know which of the following key characteristics your clinical teams address for patients with type 2 diabetes as part of standard protocol. Select all that apply. My demo organization addresses current lifestyle, comorbidities, clinical characteristics associated with CVD risk, and social determinants of health, but not issues such as motivation or depression. So I'll leave that blank. Note, the last two options, one, that you do not have a standard protocol, or two, that you're not sure of the key characteristics, cannot be combined with any of the previous options. Question 8 is also a modified question from previous years. We ask, when your organization operationalized treatment plans for managing patients with type 2 diabetes, which of the following considerations does the treatment plan include as standard process? Make sure to select all that apply. My demo organization's treatment plans include the use of guideline-based treatment algorithms, the use of the ASCVD risk calculator, and the use of guideline-based pharmacologic therapy, inclusive of cardio and cardiorenal protective therapies such as SGLT2 inhibitors and GLP-1 receptor agonists. Again, you cannot select either of the last three options in combination with other selections. Question 9 is broken down into 6 sections. For questions 9A through 9F, please indicate where the specific therapies are being prescribed for patients with type 2 diabetes. Each question asks about a different therapy or group of therapies, including angiotensin system blockers like ACE inhibitors or ARNIs, other antihypertensive medications such as beta blockers or diuretics, lipid-lowering medications, DPP-4 inhibitors, GLP-1 receptor agonists, and SGLT2 inhibitors. Each sub-question gives you the option of family medicine or internal medicine, another specialty, for example, general cardiology, specialty clinics such as those focused solely on lipid or cardiometabolic care, none of the above, because either you refer to an external specialty provider or because you neither prescribe nor have a process for referral. I'll complete my answers now. Question 10 asks about the barriers your organization experiences in relation to the initiation of guideline-directed medical therapies for cardiorenal protective medications, such as SGLT2 inhibitors and GLP-1 receptor agonists for patients with type 2 diabetes. If you select the first option, system-based barriers such as your formulary or prior authorization limitations, an additional question will appear, asking for the factors that impact accessibility of those medications. If this appears, you must answer the question. Make sure that you scroll so you can select all that apply to your organization. Question 11 asks if your organization routinely evaluates kidney health for patients with type 2 diabetes. If you respond with yes, additional questions appear to gather more detail on your organization's assessments. As in previous questions, you cannot select either of the last two options in combination with other selections. Please note that you must answer these follow-up checkboxes if they appear. Leaving these unanswered generates a red critical error, which will prevent you from saving your form. Note, you won't be penalized for your answers in questions 7 through 11. These questions are largely a self-assessment to help identify where you may have gaps in standard best practices. These gaps may need to be addressed to improve patient outcomes. Question 12 asks if your organization is committed to continuously improving strategies for addressing cardiovascular disease risk in patients with type 2 diabetes. You must answer yes to be eligible for an award. Selecting no generates a note that tells me I'm ineligible. Make sure to save as you go. The final questions are housed in the Measure Submission tab, which you can find on the top right. Question 13 is the denominator of the MIPS number 1 measure, which is required for recognition. This denominator asks for patients who had a 2022 office visit and have been diagnosed with diabetes. Using the MIPS number 1 measure, which again can be accessed via this link, how many patients met these criteria? My demo organization had 8,252 patients with diabetes who had a 2022 office visit. Question 14 is the numerator of the measure. Of the patients with diabetes from question 13, what is the number of patients whose most recent hemoglobin A1C level, taken in 2022, was above 9%? Make sure to review the official measure logic for all criteria. Patients with diabetes who did not receive a hemoglobin A1C test in 2022 still get counted in the numerator, along with patients whose test level was above 9%. Again, the lower the numerator, the better the clinical performance. My demo organization had 2,326 patients meeting the numerator criteria. In other words, 2,326 patients who were poorly controlled. Questions 15 and 16, as well as 17 and 18, are optional, but you need to answer one of these question pairs for recognition. Questions 15 and 16 are the denominator and numerator of the MIPS 438 measure. This measure asks for patients who are considered at high risk for a cardiovascular event under the American College of Cardiology and American Heart Association guidelines, and were prescribed or taking statins in 2022. Use the MIPS 438 logic linked here. When calculating, you can determine how many patients are in each risk group and provide the sum of all three, but be careful not to double count patients who fall into more than one risk group. For full details on this measure, check out our video on how to submit data for check change control cholesterol. I'm choosing to leave these blank and answer questions 17 and 18 instead, since I already have data easily available for the next measure due to my organization's participation in Target BP. Remember, I will give an identical answer here as I provided in Target BP. Questions 17 and 18 are the denominator and numerator of the MIPS 236 measure. This measure asks for patients diagnosed with essential hypertension whose blood pressure was less than 140/90 millimeters of mercury at their most recent 2022 visit. For full details on this measure, check out our video on how to submit data for Target BP. My demo facility had 991 hypertensive patients. And of those patients, 17,454 showed a blood pressure under 140/90 at their most recent 2022 visit. To complete your data submission, make sure you filled in both fields for the diabetes measure and both fields for one of the cardiovascular disease measures. Once all fields have been entered, return to the Participant Information tab. The last step in our submission process is to check the Data Entry Complete box. An important note, if this checkbox cannot be populated, it means your data is incomplete and you may not be eligible for recognition. Please review both tabs and ensure no fields are left unanswered before exiting. I am unable to check the box. Scrolling through my questions, I can see it is because I left the other public patient count for question 6 blank. Now that is corrected, I will be able to check the Data Entry Complete box, which ensures that I am ready for recognition. Finally, I'll click Save and Exit. Thank you for choosing to submit data for Target Type 2 diabetes. If you have additional questions, please contact us at bit.ly/aqcontactus, or if you need help logging in, you can contact our platform vendor using the email address on screen now.